Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Nuvigil. Nuvigil, or R-modafinil, is a non-amphetamine stimulant approved by the FDA in 2007, went generic in 2016. It's considered a controlled substance, so it's in the Schedule 4 drugs. That's where you find benzodiazepines. The drug is a eugeroic compound. In other words, it's able to keep you awake, keep you alert for a longer period of time. It's also considered a nootropic. Nootropic means it's a smart pill. It's supposed to be a cognitive enhancer. Now, when it was originally FDA approved, it was approved for increasing the wakefulness in adults who had excessive daytime sleepiness because of obstructive sleep apnea or narcolepsy or shift work disorder. 2010, they added the symptoms of jet lag. But when we're talking about obstructive sleep apnea, remember, it's for the excessive daytime sleepiness. It's not to treat the sleep apnea itself. Well, it's used off-label for a variety of disorders, ranging from ADHD, attention deficit hyperactivity disorder, to chronic fatigue syndrome. It's used in some depressive disorders. It's used by air traffic controllers to improve their vigilance. It's thought that it might slightly improve the negative symptoms associated with schizophrenia, but actually the drug company tried to get the FDA to go along with the idea that it was a drug that should be approved for schizophrenia and for depression and bipolar disorder and for the chemotherapy-related fatigue. FDA balked on that. It's been tested, but not approved. It's been tested for idiopathic hypersomnia, in other words, people just seem to be very sleepy all of the time, or the sleepiness associated with Parkinson's disease, or even in people who just get up at night a lot to urinate, to improve their wakefulness during the day, people with cerebral palsy, people who get up because of hot flashes. Actually might decrease the incidence of hot flashes by about 50%, used for increasing the daytime wakefulness in people with multiple sclerosis or some types of depression or chronic pain or dementia, or even the somnolence that comes along with waking up from anesthesia. It's used off-label by musicians and judges and pilots and scientists. Now, Nuvigil is like Provigil, or Provigil is the same thing as modafinil, but here we're talking about Nuvigil. Well, the difference is that Provigil has been on the market since 1998, and Provigil contains two mirror image molecules, the R form and the S form. But the Nuvigil only contains the R form. That's where the name comes from, the R-modafinil. So modafinil is not quite as good because it seems to have a short-term effect, short therapeutic effect that lasts only about 6 hours with one dose. On the other hand, if you take Nuvigil, it maintains a blood concentration for up to about 15 hours, and you can have sustained attention for anywhere between 6 and 14 hours. That's much longer than you would get with the modafinil. There are fewer lapses in attention over a longer period of time if you take the Nuvigil versus the Provigil. If we look at how a person does, say, from 8 hours to about 12 hours, much better with the Nuvigil than the modafinil. Fewer side effects associated with Nuvigil. The dose of Nuvigil, well, it's 150 milligrams in the morning if you're taking it for narcolepsy and obstructive sleep apnea. You could increase the dose to about 250 milligrams, but there's no evidence that the 250 works any better than the 150. And if you're taking it for the shift work disorder, well, then taking it about an hour before the start of your shift, taking a dose of 150 milligrams, that seems to be appropriate. Now, for seniors, you've got to take a little lower dose because they might have some impaired liver function. Comes in a variety of doses. Comes in 50 and 150 and 200 and 250 milligrams. Now, if we look at how it works on obstructive sleep apnea, excessive daytime sleepiness related to that condition, well, we find it works a little bit, but not all that great. Actually seems to give you about 1.5 to 2.5 minutes of extra wakefulness compared to not taking it. If you're taking a placebo, well, it might actually make you fall asleep a little bit sooner. So it doesn't seem like you get a whole great benefit from taking the Nuvigil if you happen to have obstructive sleep apnea. If we look at how it compares to a placebo, doctors rate it, well, 70% get some improvement with the Nuvigil, about 40 or 50% get some improvement with the placebo. If you look at narcolepsy, well, how does it work? It works basically the same way it worked in obstructive sleep apnea. It works a little bit, gives you a benefit of about 1.5 to 2.5 minutes. That's really not all that much. Actually, when the doctors evaluate the patients, well, 70% get a little bit better with Nuvigil and 60% get better with placebo. So again, it's not all that great. How about the shift work disorder? Again, when we evaluate it, you might get about 3 extra minutes benefit compared to about a half a minute benefit if we're looking at the placebo. So again, it isn't all that great. And by the way, if you go to bed, it's going to take on average in a normal individual somewhere between about 12 minutes and 20 minutes to fall asleep. So people who go to bed and aren't immediately asleep, don't worry, it's 12 to 20 minutes, that's normal. Well, how about jet lag? Does it seem to work on jet lag? It seems to work for about a 12-minute time period versus about a 6-minute time period with a placebo. So again, it really doesn't seem to work all that great. Navy air traffic controllers, well, it did actually improve their vigilance even when they were well rested, had good night's sleep. Well, they seemed to perform better, had fewer lapses in attention over a lengthy period of time. So seems that it can keep the attention. How does it work? Well, it works by increasing the sympathomimetic amines that are produced by the brain. So increases the locomotor activity, sort of like the amphetamines or the methylphenidate, involves dopamine. So it seems to work on the dopamine transporter. So if we block the dopamine transporter, then it seems that the Nuvigil doesn't seem to work very well. But interestingly, it seems that it increases the extracellular dopamine, and it's not blocked by taking something like Haldol. Well, has lesser effect on the norepinephrine and the histamine sites. It's wake promoting. It increases the locomotor activity. You're moving around. It has some psychomotor and euphoric effects, so it can change your mood, change your perception, change your thinking, similar to some of the other central nervous system stimulants, but it doesn't change the REM sleep while it decreases the non-REM sleep. That's the deep sleep, the stage 3 and the stage 4 sleep. Actually also decreases the total sleep time. That's not really so good. The contraindications to taking the drug, well, if you're allergic to the modafinil or the Nuvigil, then obviously don't take it. Relative contraindication is if you have mitral valve prolapse with electrocardiographic changes, probably shouldn't take the drug. Chest pain, arrhythmias, don't take the drug. It does come with some side effects. About a quarter of the people who take the drug are going to have some headache, about 10% going to have some nausea, 5% with some dizziness or insomnia or anxiety or depression. Dry mouth is a common occurrence, about 4 or 5%. Smaller percent going to have some indigestion or actually fatigue or palpitations or abdominal pain. Some people have transient ischemic changes on their electrocardiogram, actually can cause a slight increase in the blood pressure, an increase in the heart rate. About 1 person in 6, 1 person in 7 who takes the drug actually stops taking the drug because of nausea or headache. I mean, 1 in 16 individuals stop taking the drug because of the symptoms, either the nausea or the headache. Some people who take the drug can have a serious rash, and that's a major problem, especially in the pediatric population. Now, this rash is a Stevens-Johnson type rash, so you could actually get very sick. Some people actually die from this kind of a condition. If you develop a rash while you're taking the drug, and the rash doesn't have a particular cause that you can think of, so it's not a herpes rash or you didn't just fall in the poison ivy patch, then you better stop the drug at least till you figure out what's happening. This rash is very rare. Tends to occur after as little as 1 day up to about 2 months after you start taking the drug. Rash is more common in children. tends to occur after about 2 weeks, can be associated with what's known as the DRESS syndrome. The DRESS syndrome is the drug reaction with eosinophilia and systemic symptoms. That's really a bad rash. That's a bad rash associated with fever and swollen nodes. It's associated with hepatitis and myocarditis and associated with abnormalities of your kidney. People do go on to die from that, so that's very important. That's why it's not approved for children. Some people can develop some angioedema or anaphylaxis. That's where your tongue swells and your lips swell. Some people can develop persistent sleepiness. So you take the drug because you think it's going to keep you awake, but it doesn't. So in some people, it won't keep them awake, so they have to be extremely careful because they take the drug and think they can drive the car when they're really too tired to do that. In some people, it can cause some psychiatric symptoms, especially if you have a history of psychosis or depression or mania. Some people take the drug and get anxious or agitated or nervous or irritable. Actually, some have some suicidal thoughts, but all of those are fortunately relatively rare. The Nuvigil decreases the concentration of certain birth control pills, the birth control pills that have the estrogen, the ethinylestradiol. So if you're a woman and you're taking the drug and you're taking an oral contraceptive, well, if it has the ethinylestradiol, the estrogen component, then you need another method of contraception for at least a month after you've stopped taking the drug. So all the time you take the drug, and then for another month. If you're taking a sleeping pill known as Halcion or triazolam, doesn't seem to work very well. It decreases the concentration of that. Also decrease the concentration of cyclosporin if you're taking it for a kidney transplant or something of that nature. At the same time, increases the concentration of omeprazole or Dilantin or Valium or propranolol in your system. If you're taking warfarin, you have to have more frequent monitoring. Shouldn't combine it with an MAO inhibitor. Is it safe if you're pregnant? Probably not. It can cause harm. Certainly in animals, it causes intrauterine growth retardation and spontaneous abortions and might increase the mortality of the embryo or the fetus. Lactation, again, not appropriate. We don't know the effect on the breast milk. Seems a relatively small concentration going to get through. Pediatric population, well, because of the rash and the potential, it's not appropriate for children. How about for senior citizens? Well, not going to be able to metabolize it as well, so you need a smaller dose. Actually, if you look at people who are over age 65, the systemic concentration of the drug is going to be increased by about 15% because of decreased clearance. And if we look at one of the metabolites, or modafinil acid, it's going to be increased by about 60 or 70%. You have liver impairment like cirrhosis. Well, that's going to decrease the clearance of the drug by about 60%. If you have renal impairment, something wrong with your kidneys, well, it probably doesn't need to alter the dose, but you will have an increased concentration of some of the metabolites. Well, it's considered a Schedule IV drug, as I mentioned. That seems to mean that some abuse has been reported from the drug. It seems to cause a euphoric mood, so people use an increased dose compared to what they were prescribed. People use it and divert the use of the drug, and they take a dose that could be as high as 400 milligram. And we know at 400 milligram, it seems to be involved in those areas of the brain where substance abuse also occurs. But that seems to be not really likely at a dose of 150 milligrams. Maybe a little bit at 250 milligrams, but probably not. But when you increase the dose, you have to be a little bit careful. And also be careful if you've had a history of abuse of some of the other kinds of substances. So if you've abused amphetamines or methamphetamine, or if you used cocaine before, well, you got to be careful of this one. You could overdose on Nuvigil, and if you overdose on Nuvigil, some of the side effects might be headache or increased heart rate, insomnia, agitation, dizziness, anxiety, nausea, tremor, chest pain, or hallucinations in some individuals, and delirium. Some people develop flushed, reddish skin, sweat, their pupils dilate, they have increased heart rate, they're restless, they're hyperactive, they develop abdominal pain or vomiting. There are two metabolites of the drug, drug is metabolized into R-modafinil acid and modafinil sulfone, but they don't contribute to the central nervous system effects of the drug. If we look at the exposure, anywhere from a dose of 50 milligrams all the way up to 400 milligrams, going to slowly increase the amount in the system. And actually, the concentration of 50 milligrams of Nuvigil equals 100 milligrams of Provigil. If you take the dose just once, you're going to have relatively low level, but that's going to increase to a steady state after about 7 days of taking the dose. And the steady state is going to be about 1.5 to 2 times greater than the concentration you get with taking just one pill. Actually, if we look at 200 milligrams of Nuvigil versus 200 milligrams of Provigil, we find that with the Nuvigil, there's going to be an increase in the serum concentration quite considerably, somewhere around a third, the area under the curve. The amount total in the system is going to be about 70% more with the Nuvigil than with the Provigil. That's because we have some extra fast metabolism of that S enantiomer that I talked about. Its half-life is only about 4 hours versus the R enantiomer that has the 15-hour half-life. Once you take the drug, it's readily bound to the plasma albumin, about 60% is. The peak concentration is about 2 hours if you take it while you're fasting. The food has a minimal effect, but it's going to delay the time to peak concentration by about 2 to 4 hours and increase the time to the maximum concentration, but it doesn't really increase or alter the overall concentration. It just seems if you take it with food, it's going to peak later in the system. So it's going to change the amount in your body at certain times, metabolized in the liver. Less than 10% is going to go out in the urine. This is an unmetabolized compound. It's not carcinogenic. It's not mutagenic. Doesn't seem to really have a significant impact on fertility. It's used in the black market to boost cognitive performance. Among the readers of one of the most highly prized medical journals, or scientific journal, called Nature, about 20% of the people actually use the drug. The question is, do you really perform better while you're taking the drug? Well, some people perform slightly better and some people perform slightly worse while they take the drug. It seems that the people who are actually high performers, they don't really get any benefit. It's the people who aren't performing quite to the level where they could, who seem to get some boost from taking the medicine. But when they get that boost, the boost is at the price of decreased creativity and decreased flexibility in the thinking. So it can help one domain of the brain and hurt another area of the brain. So what is the most appropriate brain booster that you can take? What do you do that's going to actually improve your attention and your memory and your learning? Physical exercise and go take a nap. Those seem to be the most, but it does not seem that you're going to really get those same kind of boosts by taking either the Nuvigil or the Provigil. But if you're involved in an activity that's kind of boring, well, it might help increase your performance. And it might increase your performance after you've had a bad night when you didn't sleep. So it seems that people who take the drug seem to think that they do better during their waking hours. But unfortunately, some people think they're stuck in a twilight between the sleep and the wake. And remember, it's during the sleep that your memories are consolidated. So if the drug is going to make you not sleep well, then the drug might actually have a negative effect. Overall, the best that the drug can do is it can improve your long-term memory by less than 10%. And as a matter of fact, when we're talking about what the drug can do, it seems that your brain still evolves and still matures when you get into your 20s and your 30s. And actually, the Nuvigil can harm the developing brain. It can cause a decrease in the adaptability, decrease in the planning, decrease in the organizational skills of the brain. That probably has to do with the way it acts on the dopamine. So actually, in 2010, the European Medicines Agency, that's sort of like the FDA over in Europe, they said the drug is no longer approved for sleep-wake disorder, or the shift disorder, or the obstructive sleep apnea, the idiopathic hypersomnia. The effect is so small that it doesn't outweigh the harms. So they say you can still take it if you have narcolepsy, but that's it. Drug was invented as Arafil, and Arafil came into being in 1974. Laboratories Lafontaine, French laboratory. They were looking for a drug that was a painkiller. Didn't work as a painkiller, but when they gave it to mice, the mice seemed to move around a lot. So then they gave it to some narcoleptics in 1977. Didn't seem to do all that well, no consistent results, but they found that it was metabolized in the system, the Arafil, to a medicine known as modafinil. That's Provigil. So in 1983, they gave it to some patients who had narcolepsy, the Provigil, and they found it seemed to work fairly well. Well, around the same time, people were suggesting that, well, you ought to go promote the drug, but Laboratoire Lafontaine was a small laboratory, didn't have a lot of money, but Sandoz, big drug company, they were losing their patent exclusivity on Hydrogene. That was a medicine for older people, a cognitive enhancer. So the Arafenil, that seemed to enhance the vigilance and the attention and the behavior and the mood, so they kept working on it. And then through a series of changes and promotions, it got a foothold. A gentleman wrote a book in 2001. Alan Glynn wrote it called Dark Fields. They adapted it into a movie in 2011. It was called Limitless. And that into a television show in 2015. It was a struggling writer who was introduced to a nootropic drug known as NZT-48. Unlocked the full potential of his brain, enhanced his mental faculties. He was able to write a book in 4 days, learn Italian overnight, develop fine taste in art. Pill seemed to be based on the Provigil. Well, as the patent expired on the Provigil, that's when they got rid of that S enantiomer, used just the R enantiomer, and brought it out to the market as Nuvigil. So the company raised the price of Provigil, so more people would take the Nuvigil. They cut some costs on the Nuvigil, tried to get people to take it. Actually, the two drugs, the Nuvigil and the Provigil, that was 50% of the market for the company, Cephalon Pharmaceuticals. They subsequently sold to Teva, that's a large generic drug company in Israel, sold it in 2011 for about $6 billion. Well, how much, if you wanted to go buy the drug, how much would it cost? How much is a generic Nuvigil? So you could buy 30 of the 150 milligram. If you wanted to do it for cash, it would be anywhere between about $500 and $680. If you have a coupon that you can get GoodRx, you go to Costco, get it for $31, or at CVS for $117, or at Walgreens for about $200. The brand name drug is going to cost you for the same amount about $1,000, and even with the coupon, it's going to cost you between $800 and $900. But if you have a copay card for the name brand drug, you can get it for as little as $10. But that means that they're going to charge the insurance company a horrible rate, and then you're going to complain next year when your insurance rates go up. By the way, that kind of shenanigan is not approved for Medicare, Medicaid, or TRICARE. If you wanted the modafinil, that's the Provigil, well, you could get that cash over at Costco for $42, or if you went to Rite Aid, for exactly the same thing that you could get at Costco for $42, at Rite Aid it's $994. If you have a coupon, many locations you can get it for as little as $31 at CVS, and at Walgreens it's going to cost you between $275, $300. So that's the story about Nuvigil, stepbrother of Provigil, for the excessive daytime sleepiness associated with obstructive sleep apnea and the shift work disorder and jet lag and narcolepsy. Does it work? Really only works a little bit. Does it help with the memory? Is it really a smart pill? Well, the answer for that is kind of complicated. And for many, the side effects seem to outweigh the benefits. Studies show that if you're functioning at a high level already, pill isn't going to do much for you. And remember, the memory consolidation occurs when you're asleep, and Nuvigil is going to shorten your nighttime sleep. So if you take it, be extra careful. Anyway, thanks for watching. I'm Dr. Ken Landau. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new shows. Appreciate your interest.